One of the only things that you can count on regarding Medicare Advantage coverage can be summed up with one simple word: change.
But I don't like change.
Whether you've been with the same plan for years or you recently switched, the facts remain the same. Medicare Advantage plans, they can and will change every single year. We have already discussed in previous videos the important changes coming to Medicare Advantage in 2025, largely due to the Inflation Reduction Act, and many of you have likely also been bombarded by news of large Medicare Advantage plans pulling out of certain markets, reducing benefits, and more. Regardless of the doom and gloom that's being portrayed, there are very specific things that you can do right now to avoid making mistakes with your Medicare Advantage coverage. My name is Cameron Giardini with Giardini Medicare, and in today's video, we will walk through the steps that we take with our own clients to narrow down Medicare Advantage options. Our goal is to show you how you can choose a specific Medicare Advantage plan in 2025 that meets what you are uniquely looking for. Although we will talk about the process of comparing different Medicare Advantage plans to your current Medicare Advantage plans, those of you watching this and considering Medicare Advantage for the first time will still be able to benefit from the same information. If you're watching this and you think we only promote Medicare Advantage plans and not Medicare supplements, make sure you go back and watch our other Medigap videos so you can see that is simply not the case. Keep in mind throughout the video that unlike changing Medicare supplement coverage, changing from one Medicare Advantage plan to another does not require you to answer health questions or go through medical underwriting. So you can change plans without worrying about your current health status. Also, if your Medicare Advantage plan is leaving your county entirely, you do have access to guaranteed issue rights for a Medicare supplement plan. Before you even begin to look at the many different Medicare Advantage plans available in your county, it is crucial to take a close look at how your current Medicare Advantage plan is changing for 2025. To do this, you should look at 3 different plan documents. This is the annual notice of change, summary of benefits, and evidence of coverage. However, if you are not currently enrolled in a Medicare Advantage plan, you can skip to step 2, which is at the timestamp you can see here on the screen. When reviewing these 3 different documents that we just mentioned, make sure you are paying extra close attention to the coverage that matters most to you and will have the biggest impact on your situation with your current plan. For example, you might need outpatient surgery in the upcoming year, so you should check the specific copay for that service. Or maybe you see specialists on a regular basis, so the copay you pay per visit for a specialist will be important to double check. Or maybe you're simply concerned with prescription drug coverage and you want to see how that coverage is changing. One of the more common changes that you will see is to your plan's extra benefits. In addition to the coverage changes for extra benefits, make sure to see if the vendors and the networks for using extra benefits are remaining the same or changing heading into next year. For example, your plan, it might still provide a gym membership, but it might use a different vendor with different networks of fitness locations. Or maybe you will still receive dental coverage through your plan, but the network is changing and your dentist is no longer covered. No matter what you're looking for, one of these 3 documents that we mentioned will provide the answer. The first document that we mentioned, the Annual Notice of Change, also known as the ANOC, it is sent to you as a physical letter in the mail or electronically every year by your current Medicare Advantage insurance company, and at this point you should have already received it by the end of September. If you do miss this notice, don't panic. You can call your Medicare Advantage company to request a copy of it, or it is also possible to find a copy online as you can see here on the screen. The Annual Notice of Change even makes some suggestions for comparing different plan options. These suggestions, they include reviewing your medical and prescription coverage, changes to the list of prescription medications covered by your plan, as well as provider and pharmacy networks. And it even suggests simply asking yourself, are you happy with the plan? Which I think is always a good thing to just think about. You can see here an example of an annual notice of change and how the different plan details from the current year are compared side by side to the upcoming year's coverage. The second document is the summary of benefits. This document can often be found in your online member portal for your Medicare Advantage plan, or you can request a physical copy directly from your plan. If not, this can also be found online using the insurance company website, as you can see an example here. Just like the name implies, this document provides a good overview of your Medicare Advantage benefits, all in one relatively easy to read document. This can be helpful when comparing your current Medicare Advantage plan, especially to others on the market, which we will talk about shortly. Now, the last document is the Evidence of Coverage, or the EOC. Like with the annual notice of change, your current plan should send you this document by the end of September. This is by far the most detailed document that you will receive regarding your Medicare Advantage coverage, and this really should be the go-to whenever you have a question about exactly what and how your plan covers different services and benefits. We really recommend finding the online version of the Evidence of Coverage and saving it to your computer. The reason for this being that you can see here, these documents, they are often a couple hundred pages long, and searching through them is much easier online using the Control F function on your computer. That way, if you have a specific question about your plan, like prior authorization, you can search for that specifically and see what comes up. You know, the more I see comments about me moving my hands, the more I think about it when I'm making these videos. But back to the video. After reviewing these different documents, you can now effectively compare your current coverage to other Medicare Advantage plans on the market.
Showtime.
Of course, this will be easier with the help of an independent broker, so if you do want to connect with somebody else like ourselves or someone else we know, we will leave the link in the description for you to use. As always, using a broker costs nothing extra. You can see here from the Kaiser Family Foundation how many different Medicare Advantage plans are offered nationwide in each county in 2024. In fact, in our home area of Metro Detroit, it is very common to have 60 or more Medicare Advantage plans available in just one county. And we don't see this changing much for 2025. This means that scouring plan documents for every available Medicare Advantage plan, it's virtually going to be impossible. But thankfully, that is where step 2 of our process comes into play, which is running a prescription drug analysis using Medicare.gov. We do have a more in-depth Medicare.gov prescription tutorial that you can see here on the screen, so we will be going through some of these steps a bit quicker. First, you go to the official Medicare.gov website, and then you click where it says Find Plans Now in the Find Health and Drug Plans section. Then you enter your zip code and you make sure 2025 is of course selected. Then choose Medicare Advantage for the type of coverage that you want to look at. And for the next step, if you do receive Medicaid through your state or low income subsidy known as Extra Help from the federal government, you will want to select one of those options. For this video, we will keep things simple and we will choose that you don't get help from any of these programs, and we will continue. Now at this point, you will want to add the prescription medications that you plan on taking through the upcoming year. You can see on the screen an example of adding the medications, but to add more, you will click Add Another Drug and then simply repeat the process until your full list is included. Finally, click Done Adding Drugs, and then after adding your medications, we will select different pharmacies for you to compare the prices at. In this case, we do only recommend you put the ones you actually are willing to use, but then after adding up to 5 pharmacies, you'll click Done. Now at this point, you will want to make sure that the plans are being sorted by the lowest drug and premium cost. You'll see that as we scroll down, the total drug and premium costs will increase. These costs, they project the estimated total that you will spend for the year on both your plan's premiums and medications that you included in your list, and that is of course if nothing changes throughout the year. And as an added tip, yes, it does include the deductible in these estimates. To see more information about the prescription coverage for a specific plan, simply click where it says Plan Details. If you scroll down, you will then see where you can see which pharmacies are preferred, which are standard, and even which ones may be simply out of network. Lastly, you can see additional details like the estimated cost per medication throughout the year, as well as different tiers for each medication and whether or not they require restrictions like prior authorization or step therapy. If we go back to the main page and see all of the plan comparisons, you can also directly compare prescription cost for up to 3 plans at a time. For our example, we will choose the Humana plan with the lowest overall prescription cost, the Blue Cross PPO, and for the sake of this analysis, we will assume you are currently enrolled in the AARP United Healthcare PPO plan that you can see here on the screen. As we scroll down in the comparison, you will see the prescription costs for all three of these plans side by side. Clearly, there is a drastic difference in overall prescription costs between the United Healthcare plan and the other two. This brings up a very important point before moving on to step 3 of our choosing a Medicare Advantage process. And this is to remember that when you review the prescription drug coverage for your current plan for the upcoming year, your coverage may change, and then you find that a medication is no longer being covered. This leads to much higher out-of-pocket costs, of course, which is exactly the case when we look at the details of this United Healthcare plan and we see that the Novolog that we entered is not a covered medication by this plan for 2025. Before rushing to change Medicare Advantage plans because of a change in medication coverage, just remember that Medicare Advantage plans, they are bundled plans, which means that medical coverage, prescription coverage, and supplemental benefits, they are all provided by the same plan and insurance company. If you choose to change coverage solely because of prescriptions, this means that all other aspects of your plan will change, which includes doctor networks and more, which we will cover soon. If you realize one of your medications is no longer covered for next year, first, you should ask your doctor if there are alternatives to your medication that will still work for you, but which are actually covered by your plan. For example, instead of Novolog, if we look at the formulary for the actual United Healthcare plan, it's worth asking if one of these other covered insulins could work instead. If the answer is yes, you might find it easier to change a prescription versus changing to a different plan entirely if you're happy with the overall coverage it provides. Now, I can't stress this enough though, this is not medical advice. You should not expect a broker to tell you which medications to take, but for the sake of our example, if your doctor does say that you could change from Novolog to Humalog, then all of a sudden, the prescription coverage for the United Healthcare plan becomes much more cost effective. If you do in fact have to take a very specific medication, you can always look for lower cost outside of your Medicare Advantage plan through other sources like GoodRx, Cost Plus Drugs, or manufacturer assistance programs. As a last resort, you can also try a formulary exception to see if your plan will make an exception and cover your normally non-covered medication at least for the upcoming year. At this point, you may simply find yourself in a position where you must consider or change to a new Medicare Advantage plan for the upcoming year, but hopefully, after narrowing plan options based on prescriptions, you will have a much smaller handful of plans to consider instead of the dozens of options at the beginning of the process. The next step in the process is to compare the plan benefits of the Medicare Advantage plans you're considering. This will include looking at both the medical and supplemental benefits. Luckily, we don't have to look at the details for 60 plus plans, since again, we have already narrowed down our options to either the current United Healthcare Medicare Advantage plan or to the Blue Cross or Humana plan, which was again based on our prescription drug analysis. When diving deeper into the plan benefits of the various Medicare Advantage options, we strongly recommend that you judge Medicare Advantage plans by their medical coverage first, and then you look at the extra supplemental benefits as a cherry on top. With that being said, using Medicare.gov, we can quickly compare factors like star ratings, monthly premiums, maximum out-of-pocket limits, as well as medical and prescription deductibles. Although most Medicare Advantage plans have $0 per month premiums, some plans will come with higher premiums, so keep that in mind when you're comparing options if that is the case. For star ratings, we generally recommend narrowing down plan options that are rated at least 3 stars or higher, which are considered average or better. It is also good to be wary of plans that are specifically highlighted as receiving low star ratings for multiple years. Medicare can and will terminate plans that have failed to achieve a 3-star rating for at least 3 years in a row. But overall, this doesn't mean you should automatically choose a plan just because it has the highest star rating possible if the overall plan doesn't match what you're looking for. As we scroll down the plan comparison, you will see some of the extra benefits that are or are not included in the various plans in the plan features section. And then below that, you can see the copays and the costs of the core medical benefits of the plan. However, you may also notice that for many services, Medicare.gov, they simply give a range of costs, and it is missing many important details. Because of this, we will instead use a different website to compare the benefits of various Medicare Advantage plans. This website we will use is ehealthinsurance.com. Frankly, we should not be showing or promoting this website since it is run by eHealth, a national competitor to brokers like ourselves, but we have to admit they have a pretty good website. Although we recommend using their website for this comparison, make sure you don't contact them and don't put any personal information on their website. When we put our zip code and choose Compare Medicare Plans, it should take you to a list of the different Medicare Advantage plans in your area. The reason we choose to use their website is that we can add our current plan to the comparison, and then we can compare in much more detail the medical and supplemental benefits for the plans that we have narrowed down previously using Medicare.gov. We will compare 4 plans in this case. Make sure when you choose these plans that you are choosing the exact same plan from Medicare.gov with the same exact ID number. For example, you can see this Blue Cross plan matches the previous plan that we saw on Medicare.gov, just like this Humana plan matches the Humana Giveback plan from earlier. There are far too many things to scrutinize in just this video, but overall, here are some things to consider when you're comparing different costs of different plan options. First, think about the medical services that you have actually needed through the current year, and then pretend what the cost would have been with these different plans. For example, if you were hospitalized for a few days, we can look at the different inpatient hospital costs for each of these plans to see how that might compare. Now, this process applies to all services such as primary care visits, specialist visits, physical therapy, and much more. At this point in the process, we also see people fixate on the maximum out-of-pocket limit, but just know typically only a small percentage of people actually reach their maximum out-of-pocket limit each year. Now, if you do have a serious medical condition and you are likely to reach this limit, then it may be the main factor when choosing plans. But for many of you watching this, it will simply be something to consider and to understand instead of actually being the deciding factor. Using this comparison, we can quickly see some of the drastic differences between the options. For example, the Humana plan provides a much larger Part B premium reduction, but in exchange comes with a higher deductible and a much higher maximum out-of-pocket. This shows that there is more to consider than just the prescription coverage we talked about in Step 2. When moving on and narrowing down Medicare Advantage plans by their extra benefits that they provide, make sure to keep some of the following questions in mind. Number 1, think, what is important to me? This is self-explanatory, but think, for example, about whether you want the most dental coverage possible or whether preventive coverage will suffice. Also, think, do you use hearing aids? Is transportation extra important to you? The list goes on, but you should really take the time and write down what you're looking for. Don't just choose one flashy extra benefit that you won't actually use. Number 2, ask yourself, can I actually benefit from what is being offered? This might sound a bit dumb, but the fact of the matter is that extra benefits are only helpful if you can use them. If the plan is offering a large amount of dental coverage, but your dentist is not in the network and you're not willing to change, does it do you much good? Maybe not. The same applies to vision and hearing benefits. Also, gym memberships will involve using a gym in a specific network. The same applies to essentially all of the extra benefits provided by a Medicare Advantage plan. I'm not saying that they're difficult or impossible to use, but they do have specific rules and criteria if you're going to take advantage of them. So think twice before you are enticed by a plan that sounds simply too good to be true. If you want to see even more details about the plans or the extra benefits that they offer, eHealth does a great job of making the documents that we talked about earlier easily available, such as the summary of benefits and the evidence of coverage. If you click on one of the links below, you'll see the summary of benefits pulls up on the screen, and then again, you can search for different plan details that you would like. Lastly, when you're comparing different Medicare Advantage options, you will often see that HMO plans often come with lower out-of-pocket cost or additional supplemental benefits compared to PPO plans. But whether or not an HMO or a PPO might be right for you will come down to your network of doctors and providers, which brings us to our final step in the video. As an important reminder, when you are enrolled in a Medicare Advantage plan, the plan becomes your primary coverage instead of original Medicare Part A and Part B. Because of this, you will want to make sure that your doctors, hospitals, and more are actually in network with the specific Medicare Advantage plans that you are considering. It is not as simple as ensuring that your providers accept original Medicare. You might logically think that you could find Medicare Advantage provider networks using Medicare.gov, but although they have a search tool to help you find providers that accept original Medicare, there is no search tool on the website to find specific providers that are in network for a specific Medicare Advantage plan. It is possible to put your doctors on the eHealth website to compare which are in or out of network for the different plans, but we always recommend instead using the specific website of the company providing the Medicare Advantage plan. Now, this isn't always easy to find on your own, but for example, we can go to Humana.com. We can scroll down slightly and then we'll see where it says Find Care. When we click on the link, we can continue as a guest and then we can see if your specific providers are in network. For example, we can put in the zip code, change the distance if you want, and then select Medicare and 2025 as a lookup method. At this point, you will want to make sure you choose the specific network, which in this case is the Medicare PPO 2025, and then we will search by all. Choosing the correct network is very important because as you can see here, there are different networks even among Medicare Advantage plans from the same exact insurance company. Then we can type in the name of our example primary care provider, and then we see that they are in fact in network with this specific plan. As a reminder, with Medicare Advantage plans, the network is not as easy as just making sure your primary care doctor is in network. You will also need to check specialists that you plan on seeing, as well as hospitals that you want to access outside of emergencies. If you are also someone who uses durable medical equipment, you will want to check the specific network of DME providers. Lastly, you will want to check extra benefit networks like routine dental, vision, and hearing providers. Just among the 3 different insurance companies whose Medicare Advantage plans that we have compared earlier in this video, each one has a different network for both their dental and vision providers. Because checking provider networks can be overwhelming, although we wanted to show you the steps in this video, it will be much easier to compare and confirm Medicare Advantage provider networks with the help of an independent broker so you don't have to go it alone. You can also double check and call your provider's office directly to verify if they are in network with a plan you are considering. But be careful. Do not call and simply say, "Are you in network with Humana?" for example. If you do, they won't know if you're talking about employer health insurance, Medicare Advantage, Obamacare, and other types of health insurance. So even if they say yes to that question, the answer is meaningless. Instead, you can speak with the provider's billing department and ask, "Are you in network with the Humana Medicare Advantage PPO plan with the ID number H5216-306? Now, this is not guaranteed to work and they might not know what you're talking about, but hopefully it will provide a much more specific and useful answer than just asking, "Do you accept Humana?" Now, before you think that choosing a PPO will be the answer to any of your possible network worries, that is not the case. Although PPO plans, they do allow you to receive treatment outside of your plan's network, and they generally provide more flexibility compared to an HMO, they are not a ticket to just go wherever you want, whenever you want.
But why not?
If we look at a plan document from a PPO Medicare Advantage plan, we can specifically see that out-of-network providers, they are not obligated to treat you outside of an emergency. Also, even in circumstances where you can go out of network, the costs with the PPO plan, they may be higher out of network compared to in-network services, although that is not always the case with every plan. After looking at all of the various factors that go into choosing Medicare Advantage coverage, it is essential to understand that choosing a Medicare Advantage plan, it often involves making some sacrifices. We all want zero premium plans with the largest network, the lowest copays, and the most extra benefits possible, but in reality, no plan has everything. You will need to weigh the trade-offs, such as whether you are willing to change certain medications for a plan with medical benefits you prefer, or if changing your doctor is worth higher level of extra benefits. And oftentimes, there are multiple Medicare Advantage plans that can and will work for you. Instead of trying to fixate on finding the perfect plan, just use what we have talked about and consult with an independent broker to find a plan that will fit well enough for you during the upcoming year and then adjust in the future as necessary. However, if you simply want to stay with your current plan and it is still being offered for the upcoming year, There's nothing you need to do, and your plan will renew for next year with the updated 2025 benefits. Lastly, for those of you who want to take additional steps and compare Medicare Advantage coverage to Medigap coverage, make sure you watch the video that you can see here on the screen.